Still, the very best and optimal treatment for patients with peripheral artery disease is good medical therapy, because we know that patients with peripheral artery disease are at high risk for cardiovascular complications from their disease. They have a 6-fold higher risk of heart attack or stroke than patients that don't have peripheral artery disease. So there are a number of medical therapies that are critically important for PAD patients, including smoking cessation, probably the #1 most important thing that we can do for patients. Cholesterol reduction with statins, critically important. Antiplatelet therapy with aspirin or sometimes dual antiplatelet therapy. And then ACE inhibitors have been shown to be of benefit for PAD patients. And then if they have diabetes, good management of their diabetes, good foot care, and control of their blood pressure. Also critically important is a walking program, because that can be very beneficial for patients with intermittent claudication. To get them in a walking program, preferably supervised walking, and they will improve over time, be able to walk further with less discomfort if they're able to adhere to that type of a exercise program. There are a number of important clinical trials that are ongoing for patients that have critical limb ischemia, or basically peripheral artery disease that is so severe that it threatens their limb. They have non-healing ulcers or gangrene or ischemic rest pain. There's an important multi-center trial sponsored by the NIH, the BEST CLI trial, which is comparing the best surgical revascularization with best endovascular revascularization for patients with CLI. And so we'll learn a lot from that trial as to what is the best approach to revascularization in these patients. Should they receive surgery up front? Should they be treated with endovascular? And what will provide them the best outcomes. For patients that don't have good options for revascularization, there are the regenerative therapies, stem cell therapies, gene therapies, which still hold great promise. So that's been an area of interest for us here at UC Davis, looking at stem cell treatments to basically try and grow new blood vessels, what we call therapeutic angiogenesis. And so these treatments are a promising approach. And although the research is going slowly, hopefully sometime in the future we'll have that as an option for our patients with very severe disease.